Hello, my name is Terry Pratt, and I'm one of the faculty members for the North American Institute of Manual Therapy, and I want to welcome you to the Lumbopelvic 1 course, or the C511 course that we're going to be offering. This is our foundation for the North American Institute. A lot of people ask, should I take this course? Because they think that it's just the scanning examination, but this is actually a course on clinical reasoning and how to manage your patients effectively. As I said, it's the foundation for everything that we do. So I'm going to give you a little tour of the course and the components of the course.
This is Litmos. It's the online learning platform that we're using here at NAIOMT. This is what your view will look like when you log on to Litmos. You'll be given an email and login information 2 weeks prior to the course, and then you have 4 weeks from after the course to complete the information or complete the assignments. There's several different modules, and we're working hard and have worked hard to try to make these short little snippets that you can fit in during your day. So it looks like there's a lot of modules, but that's because we're trying to keep them 15 minutes. There are a couple that are a half hour. The ones that say 60 minutes are just because there may be some prep work to do after you watch the module. In this module, there's an assignment, pre-course reflection assignment. We ask that you complete this because we'd like some information about you and why you're taking these courses. And so there's some key questions that'll help us prepare for the day in which you're in lab. There's a module on clinical reasoning, or we call it critical thinking. This was put together by one of our faculty named Bryant Miller, and it's going to go over deductive reasoning, inductive reasoning, and some of the processes that we're going to be making as NAIOMT, because clinical reasoning is one of the hallmarks of our courses. So in this course, you're not just taking a level 1 course and learning the scan, you're learning deduction and inductive reasoning and the reasons why we're doing these tests that we're doing so we can treat our patients better. The next module is called an Introduction to the Scanning Examination, and this is Kent Kaiser, one of our senior faculty, who walks you through the reasoning that we have as NAIOMT in doing the scan and some of the critical thinking that you're going to be asked when you show up to the course. Next, we have a video called The Classic Scan. This is Earl Petman, one of our senior faculty and founders of NAIOMT, and this is a video shot in the 90s, but it shows the scan, how it's performed, and how it can be done quickly and efficiently in your clinic. It's a very good video to watch. We have a case study which you can review, and there's an assignment due prior to the course that's highlighted at the end of the case study. I'm not going to pay a lot of, this module was done by Mike Lucido. It's really excellent, and I'm not going to mandate that this part be done. It's just part of the video, and I couldn't edit it out. I will include that in the intro letter just to make sure that people pay attention to that. There's 2 videos on pain science, and this is very important because pain science is becoming, there's been a lot more information regarding the brain and pain science, so we want to spend some time going over this, and Brett Windsor has done an excellent job going over a couple modules and emphasizing pain science. Bill Temis has done our medical screening module. Who's at risk in your clinic, and are you aware? And these are some of the books that he's pulled this presentation from. It's a 13-minute presentation, and again, these are the foundations for what we're going to be doing as we advance through manual therapy. The next module is nerve injury and dysfunction, and this was done by Bryant Miller, and it's going to take you through what happens with nerves and how they respond, and it will explain a lot of the symptoms that your patients present at times. in the clinic. Some of them may seem odd um, and hard to put together, and this does a good job at filling in those pieces. Also, clinical assessment of weakness. This is important because a muscle isn't like a light switch. It's not weak or not weak. When we're talking about motor weakness, we're going to get into fatigable weakness. And we're also going to break it down to the nerve root level and also to the peripheral nerve level. This was done by Brett Windsor, and it's a really good summary on weakness. It's a short 9-minute video. Lumbar spine condition scripts. This has some music behind it. You may or may not like the music, but you're going to like the content, because at the end of the day, what this is going to show you is we're going to go through the low back, and condition scripts are shortcuts that we can take as therapists in order to look at different areas, where pain's generated and how they respond, so you can differentiate between a stenotic patient and a lumbar disc. There's Read a History of Manipulative Therapy. This was written by Earl Petman. We're not allowed to give you articles. It breaks copyright, even if they're free text articles on the line. So I've given a link that I'd like you to follow in order to read this article. Russ Case, he's one of our clinical fellowship instructors. He's done an overview of instability. He has done a great job spending about 10 minutes going over how to look at instability and what the history of it is and where we're proceeding now. I have a video on the prone instability test. This is part of the NAIOMT blog. This is not the prone instability test, but it's my suggested alternate to the prone instability test. So it's a short video that's going to go over the prone instability test. Sorry if the volume was turned up there. But we can look at the prone instability test, and then we can look at an alternate technique that might be able to pick this out a little bit more and be more relevant in the clinic. There's a slide presentation on principles of intervention. This one you just click through and read. We're going to cover this over in class as well. But because we only have 2 days, it's going to be important for us to go over these concepts beforehand. This is one of Brett's favorite flow charts. Does it move? No. Should it? Yes. Then we need to move it. Does it move? Yes. Should it? No. Then we need to stabilize it. Very interesting. Very, again, down to basics. This is a little preview for level 2. It's a video done by Bryant Miller looking at the science of sacroiliac joint and the evidence or lack thereof for whether it moves or not and how we're going to address it through the system. There's going to be another module put in, and this is going to be a functional anatomy module. We're using a program called Primal Pictures. I'm just putting the finishing touches on it. But what we can do is we can give you a 3-dimensional view of the lumbar spine and go over some of the common structures that we're going to take a look at and that we focus on during the class. And lastly, we're going to have a post-course reflection. Again, look at asking you some questions and thanking you for taking the course. We'll go over during the live part of the course how you can obtain certification through the North American Institute. But this is an overview of at least the online components. And during the live part of the course, we're going to be doing aspects of all of this. We're going to be integrating our critical thinking during the scanning examination. We're going to be looking at pain science and medical screening. And we're going to take the concepts of the nerve injury and dysfunction and principles of treatment and finding instability and integrating that into a compact way to assess patients thoroughly because the demands that were being placed on us as physical therapists are more and more. We have to do more with less time, and this will give you a system in which to do that.
So as you can tell, we packed a lot into the course in a short period of time. The online component is going to be pivotal for you to look at and review, because that's going to be the foundation of what we do over the 2 days for the lab. Our labs are very hands-on, so make sure that you're dressed and ready to move, and we're going to go over not just the scanning examination, but treatment techniques, exercises, and management strategies to make you successful in your practice. So I'm looking forward to seeing you guys at the course, and thank you very much for taking a course through the North American Institute.